The newest variant of COVID-19 continues to spread across the country, fueling a new wave of infections and hospitalizations. Today, the White House COVID response team warning Americans to take precautions and to protect themselves. 12 News reporter Anita Buffoni is joining us now with the important details you need to know about this latest variant. Anita.
Well, Chelsea, the newest variant's ability to infect people who are vaccinated is not a reason to wait to get the updated shot later this year. Health leaders say that could be risky because the current shot prevents against serious illness and death. COVID-19 is far from over. That's what national health leaders explained Tuesday. The highly transmissible subvariant known as BA4 and 5, an offshoot of the Omicron variant, is causing the newest wave of infections. Updated vaccines are currently being developed to better protect against the latest COVID variants, which are able to evade vaccine and natural immunity.
Getting vaccinated now will not preclude you from getting a variant-specific vaccine later in this fall or winter.
Dr. Ashish Jha, White House COVID-19 coordinator and dean of Brown University's School of Public Health, said there are talks about expanding eligibility for a second booster to all adults, but no decision has been made yet. Despite the strain's ability to reinfect, White House officials say to stay up to date on your COVID shots to protect against severe illness.
We know immunity wanes with coronaviruses, whether that is natural infection or vaccination.
The BA4 and 5 strains are the most contagious variants yet. To stay protected, health officials say masking in large crowds also helps. In Rhode Island, there is a slight uptick in weekly hospital admissions. In the week of July 9th, there were 79 admissions compared to 70 the week before that. Over the weekend, from Friday to Monday, the Rhode Island Department of Health reported 720 new COVID cases. Now, the updated vaccine that protects against these latest COVID variants is expected to be rolled out in October or November. In studio, Anita Buffoni, 12 News.
BA5, 2 letters and 1 number that national health leaders say is powering a new wave of COVID infections and hospitalizations. The White House COVID response team held a briefing outlining their strategy to combat this subvariant. 12 News reporter Anita Buffoni is breaking down what you need to know. Anita.
Well, Chelsea, an updated COVID-19 vaccine is expected to be available in the fall that better protects against variants of the virus. The health officials say that's not a reason to wait to get up to date on your shots. The BA5 variant is the most transmissible COVID strain yet. It's now the most dominant in the United States. A key feature is its ability to reinfect those who are fully vaccinated and who recently had COVID-19. Now an updated vaccine is in the works, but Dr. Ashish Jha, White House COVID-19 coordinator and dean of Brown University's School of Public Health, says not to wait until the new shot is available because the current vaccine protects against serious illness and death.
First of all, getting one now protects you for the rest of the summer into the fall. Second, does not preclude you from being able to get a bivalent vaccine in the fall.
Amid this new wave, there are discussions about expanding eligibility for a second COVID booster to all adults, but no final decision has yet been made.
So I know that the FDA is considering this, looking at it, and I know CDC scientists are thinking about this and looking at the data as well.
The BA5 variant is fueling a rise in cases and hospitalizations nationwide. Rhode Island is seeing a slight uptick in weekly hospital admissions. According to data by the Department of Health, in the week of July 9th, there were 79 admissions compared to 70 the week before that. From over the weekend, there were 720 new COVID cases. And that updated COVID vaccine that the FDA panel has given the green light on is expected to be available in October or November. Anita Buffoni, 12 News.